Hello, my name is Emerson Velasco. Today I'm going to talk to you about understanding the role of the gastrointestinal microbiota in modulating the antihypertensive effect of hydrolyzed egg white. We're going to start talking about hypertension. It is a multifactorial disease in which factors such as genetics and environment and lifestyle plays a role on its mechanisms. For the purpose of this study, we're going to focus on the hyperactive RAS pathway. RAS stands for renin-angiotensin system. There are already pharmacological interventions to treat hypertension. However, these ones have side effects, and therefore the necessity to find natural alternatives with little or no side effects that, even though will not replace the pharmacological intervention, they might help to reduce the risk of suffering from it. One of these alternatives is the egg white hydrolyzed. Hydrolyzed is produced by enzymatically hydrolyzing egg white protein with thermolysin and pepsin. It has been shown that it has antihypertensive effects or capacity in vitro. However, Majumdar et al. Wanted to understand how this happens in an in vivo model of genetic hypertension, such as the spontaneously hypertensive rats. They had three groups: a control, egg white protein, and egg white hydrolyzed treated groups. After treating them for 12 days, they found out that the hydrolyzed effectively reduced the mean arterial pressure. Also, the hydrolyzed decreased the expression of the AT1 receptor responsible for vasoconstriction and increased the expression of the AT2 receptor responsible for vasodilation. Effectively, the hydrolyzed has antihypertensive capacity, and over time, this increases. However, there is a possibility that this happens because the absorption of the peptides is increased over time. We propose that the digestion-resistant fraction of the hydrolyzed undergoes a gut microbiome fermentation. The gut microbiota will produce peptides and metabolites. Han et al. Found out that by fermenting soybean peptides, the gut microbiome can produce short-chain fatty acids, such as butyrate. And Dalmaso et al. Found out that by treating gastrointestinal epithelial cells with 5 millimolar butyrate concentration, the mRNA levels of the peptide-1 transporter increased. This transporter is responsible for transporting small molecular weight peptides through the gastrointestinal epithelial cell barrier. To test this hypothesis, we produce our own digestion-resistant fraction from the egg white and egg white hydrolyzed, perform an in vitro model of microbial fermentation by using mice fecal microbiome, and as well use the microbial metabolites from the fermentation to treat intestinal epithelial cells for 12 hours and analyze their expression of the peptide-1 transporter. We found out that the abundance of the firmicutes was increased, but bacteroidetes was decreased. This is expected for a protein microbial fermentation. Interestingly, the ruminococcase and lactospirase abundance was higher in the egg white hydrolyzed compared to the egg white treated group. Also, the expression of the peptide-1 transporter was higher in the cells treated by the egg white hydrolyzed. Therefore, the egg white hydrolyzed can effectively decrease the blood pressure in a genetic model of hypertension. It can also modulate the short-chain fatty acid producing families in the gut microbiome and the peptide-1 expression in intestinal epithelial cells. Future work will evaluate the role of the gut microbiota depletion and egg white hydrolyzed in ameliorating hypertension in spontaneously hypertensive rats. We will also elucidate the role of the gut microbiome in the absorption of egg white hydrolyzed peptides and the expression of amino acid and peptide transporters. I want to thank my lab mates, my collaborators, and the Franken Mussel and Ines L. Mussel Poultry Research Funds. Thank you for your attention, and I'm happy to take any questions.